Welcome to Madison Health's Postpartum Discharge Instruction video. Before going home, we here at Madison Health would like to provide some guidance about how to care for yourself and your infant from the time you deliver your baby to about 6 to 12 weeks after delivery. Vaginal bleeding. It is normal to have vaginal bleeding after delivery. During the first week, the amount and appearance is often similar to a period. After the next few weeks, it will gradually decrease to a dry, yellow-brown discharge. For most women, bleeding stops completely by 4 to 6 weeks after delivery, but can vary. Watch for any changes in your flow, such as a sudden increase in volume. Soaking a pad an hour is too much bleeding. A change in color, such as green. Passing large blood clots. If you pass a blood clot that is larger than an egg size, contact your healthcare provider and be seen that day. Uterine cramping is a normal thing, especially while breastfeeding. Motrin, other known as ibuprofen, is the medication of choice to help with cramping. This is the uterus getting back down to its normal size. You may experience stronger cramping if you've had other deliveries. Keep the perineal area clean and dry. Use medicated pads and pain-relieving sprays and creams as directed. If you've had an episiotomy or tear and/or C-section, check the area for signs of infection until you are healed. Check for redness, swelling, pain, fluid or blood coming from the cut or tear, warmth, pus, or bad smell. Use your peri bottle instead of wiping to clean the perineum area after you use the bathroom. Pat the area dry. To relieve pain caused by an episiotomy, a tear, or hemorrhoids, take a warm sitz bath 2 to 3 times a day. In a sitz bath, the warm water should only come up to your hips. Lactation will cover breast care. During breastfeeding, you may have uterine contractions every time you breastfeed for up to several weeks after delivery. This helps your uterus return to its normal size. Right after delivery, you are susceptible for a UTI. Please watch for signs of infections such as frequency, urgency, burning with urination, which is not uncommon, especially if you've had an episiotomy or tear, and a low-grade fever. Kegel exercises are very important to do because it helps strengthen the pelvic floor right after having a baby. No sexual intercourse for 6 weeks. It is possible to get pregnant and ovulate even if you do not have a period and are breastfeeding. Talk to your healthcare provider about methods of birth control or family planning at your 6-week postpartum follow-up appointment. Take over-the-counter prescription medications and stool softeners to help ease bowel movements as told by your healthcare provider. Review all previous and current prescriptions to check for possible transfer into breast milk. Risks of taking prescription opioids. Anyone who takes opioids can be at risk for addiction, accidental overdose, or death. Chances of opioid overdose increase when opioids are taken alone, mixed with other substances, taken in larger amounts, and are restarted at the same dose after taking a break from using them. Ways to use opioids safely. Keep your provider informed. Inform them of any history of substance abuse. All patients treated with opioids for pain require careful monitoring by their healthcare provider for signs of misuse and addiction and determine when meds are no longer needed. Follow directions carefully. Opioids may result in side effects, which includes drowsiness, constipation, and depressed breathing, depending on the amount taken. Take the lowest dose needed to control your pain and never more than prescribed. Reduce the risk of drug interactions. Don't mix opioids with alcohol, antihistamines such as Benadryl or Claritin, barbiturates, benzodiazepines. Combining any of these substances with opioids can lead to life-threatening respiratory depression. Please talk to your provider on more drug interactions. Gradually return to your normal activities. Rest as much as possible. Nap while your baby is sleeping. Drink plenty of fluid. To help prevent or relieve constipation, eat high-fiber foods every day. Increase calorie intake by 300 to 500 calories a day while breastfeeding. Examples are a granola bar. Baby blues are a normal thing right after delivery. You had a sudden release of hormones, and while your body adjusts and tries to regulate, you may have some extreme blues where you are crying, and you may have some extreme highs. If after 2 weeks you are still having those feelings and you are now noticing you don't want to hold your infant anymore, you're no longer having joy in spending time with your family, or you have no interest in the things you used to enjoy, make an appointment right away to see if you are experiencing postpartum depression. If your infant is crying and you have gone through the cry plan that your nurse will provide to you, place your infant in a safe place in a separate room for 15 minutes and let your infant cry it out. This allows for a reset and allows you to breathe through a stressful time. It provides that time out that you may need. After 15 minutes, get your infant and try the cry plan again. When to seek medical care? A 911 call would be pain in your chest, obstruction in your breathing or shortness of breath, seizures, thoughts of harming yourself or others. When to be seen by the provider that day? If you notice your leg is red, swollen, painful, and hot to the touch, these could be signs of a blood clot. Before placing your infant into the tub, make sure you check the water with your wrist that is the closest to your baby's skin. Make sure that you do not place your baby alone on a couch or a chair. Avoid latex and balloons. Balloons are a choking hazard. Make sure to place all firearms in a safe. No co-sleeping with your infant. Make sure your smoke and carbon monoxide detectors have their batteries and are placed properly. If you have pets, make sure to introduce your baby slowly to them. Make sure to schedule all of your follow-up appointments. Everyone should have a 6-week postpartum follow-up. Your provider may want an earlier appointment, but keep your 6-week follow-up. Thank you for choosing Madison Health for your hospital needs.
Hello, congratulations on the birth of your baby. We're so excited for you and want to make sure that you feel as successful and confident as possible when you go home with your new baby. You'll need to schedule follow-up appointments with your baby's provider 2 days after discharge, and then again when baby is 2 weeks and 2 months, and then follow your doctor's advice for future appointments. This is a nasal bulb syringe that may be used to remove nasal blockages. You can use nasal saline, 1 or 2 drops in each nostril, followed by gentle suctioning. To use the bulb syringe, you'll compress the bulb first and then put it into baby's nose and release. Once you're done suctioning the nose, clean the bulb syringe. Be careful not to do this more than once or twice per day because it can cause some swelling as well. Spitting up is a very common occurrence in the first year of life. Spitting up may have many causes such as overfeeding, swallowed air, poor burping, relaxed stomach muscles, and formula intolerance. Frequent burping and keeping the baby upright after feedings for about 30 minutes are simple and effective treatments for spitting up. Your baby's umbilical cord will turn from yellow to brown to black and will typically dry up and fall off around 10 to 14 days of age. To care for baby's umbilical cord, keep it dry by folding the diaper down off the cord. Only give sponge baths until the umbilical cord is healed. Notify your provider if the surrounding skin becomes red, swollen, or if a discharge develops. When changing your baby's diaper, make sure to clean any poop completely off baby. You may use a cream if a rash develops. Keep baby's diaper dry and wipe from front to back for girls. Also for girls, you may notice a bloody discharge in their vaginal area that may be present for the first month of life. This is caused by withdrawal from the maternal hormones. If you're planning on getting your baby boy circumcised, ask at the doctor's office for care instructions. For the first few weeks, just sponge bathe your baby until the cord dries up and falls off. Some areas of your baby's body require more frequent cleaning. Once a day, take a warm, damp washcloth to your baby's neck and hands. Milk can dribble down and become trapped in the neck creases and create irritation. For a tub bath, don't ever leave baby alone in a bath, even for a moment. Check the water temperature and make sure that it's warm but not hot before putting baby in. It's recommended to bathe only about 2 to 3 times per week and use only water or mild fragrance-free soaps. Frequently, baby will have dry, scaly skin that may peel off in the first few days. If the peeling is severe, moisturizing lotion may be used to speed up the process of healing, but the skin does not normally need oil, lotion, or powder. You may also notice a waxy, scaly substance on your baby's head. This is cradle cap, which is kind of like baby dandruff, and it may appear on your baby's scalp. While it is harmless, you can also use baby oil or a baby shampoo to soften the scales and then use a soft bristle brush to remove them. Baby's fingernails will harden in about 10 days and will be easier to file at that point. Until then, use mittens or socks to prevent baby scratching their face. It's also recommended to use a file and not clippers to prevent injury. Dress them in one more layer than what you are comfortable with wearing. For temperatures and signs and symptoms of illness, 97.7 to 100.3 is considered normal for babies. If their temperature is below or above that range, be sure to call your baby's provider. Under the armpit is the best place to take a baby's temperature. Serious reasons to call your doctor or take baby to the ER as soon as possible include difficulty breathing or bluish skin or lips. Encourage tummy time for babies while they're awake and parents are monitoring. Rotate their head from side to side to prevent the head from becoming flat. Let's talk about crying. Babies will cry every day for about the next 2 to 3 years. While this might sound scary, it's important to remember that babies cry to communicate. If your baby is fussy, make sure they're fed, warm, dry, and burped. Sometimes they need a change of environment, and just walking outside can help. Responding promptly to your baby's cries can help them feel secure. You cannot spoil a baby by comforting them. You can use the crying plan in your discharge packet, or it's helpful to run through the 5 S's of comforting a fussy baby: swaddling, shushing or white noise, swinging or rocking, sucking on a pacifier or on a parent's clean finger, and side or stomach sleeping can help soothe your baby. Stomach position is not safe for sleeping, but may have a calming effect if you're watching baby. If you've tried everything and your baby is still fussy, it's okay to put baby down in a safe place and walk away for a few minutes. Take some deep breaths or listen to some music and remind yourself that this will not last. We recommend immunizations. Check with your nurse and make sure that the hepatitis B vaccine is done if you've requested it. If you have any other questions about immunizations, ask your doctor. Jaundice occurs when bilirubin builds up in a baby's bloodstream. It is a common condition but can require treatment. It appears as yellowing of the skin or eyes. We check for this before you go home and then usually again at your first appointment in a few days. Good feedings and diapers are really important with jaundice. Bilirubin is excreted through stool, so keep an eye on the diapers out. Babies should have as many wet diapers as they are days old for the first week, and then about 6 to 8 wet diapers per day after that. Signs of worsening jaundice include lethargy, trouble feeding, and a high-pitched cry. If this happens, call your baby's provider. Here are the discharge tests that you can expect for baby before you go home. TCB. This is a screening for jaundice that is done with a little light called a TCB to test bilirubin levels before baby goes home. If this number is high, then some blood gets sent to the lab. The newborn screening, which is also known as metabolic screening or PKU. This is done in the hospital, and then the second part is done at the 2-week appointment at the doctor's office. Put this in a safe place that you will remember to take to the office, like in your purse or in a diaper bag. It's very expensive to replace, so make sure that you know where that's at and can have it for that appointment. For results on this screening, no news is good news. The newborn hearing screening. This is done in the hospital to check hearing. If baby failed, it's important to follow up in 1 month with a local audiology clinic. Safe sleep. Put your baby on their back to sleep. There should be no extra pillows or blankets in their bed with them. Baby should sleep in your room, but not in your bed. Separate bed, no co-sleeping in the same room as parents, is recommended for 6 months. Baby's crib should have a firm mattress, and do not place baby on adult beds, soft mattresses, sofas, or cushions. Do not let your baby get too hot or overbundle your baby with clothes or blankets. Once your baby is taking the breast or bottle well, you can try giving your baby a pacifier that is not attached to a string for naps and bedtime. Do not smoke around your baby. It's also important to protect your baby from illness. The best way to protect your baby from illness is to wash your hands. Stay away from people who are sick. Don't take baby out in crowded places. Newborns have underdeveloped immune systems. Don't smoke near the baby. Secondhand smoke weakens the immune system. And make sure your baby stays up to date on vaccinations. Above all, enjoy your baby, and please don't hesitate to reach out to us or your baby's provider with any questions. Thank you for choosing Madison Health.
Welcome to your breastfeeding journey. I am part of the lactation team here at Madison Memorial Hospital. We're excited to help you with your breastfeeding needs. I would like to take a moment to cover some information about what to expect with feeding your infant. First, please let lactation staff or your nurse know of any health history or breastfeeding history that would help us with your breastfeeding needs. Have you breastfed before? If so, how was your experience? What are the breastfeeding goals? Do you have any health concerns with breastfeeding? Are you taking any medications outside of delivery medications that could possibly affect breastfeeding? Will you resume your medications after delivery that could affect breastfeeding? Thank you for answering these questions. It helps us support you and your goals with breastfeeding. First, feeding frequencies. The expectation for feeding your infant at the breast is every 2 to 3 hours. Waking your infant with gentle waking stimulation if needed. Please do not let your infant sleep 5 to 6 hours at this time. Each feeding should be about 10 to 20 minutes, alternating from each breast. Your infant will start eating from each breast every 3 hours in about 7 to 10 days. The hospital has given you a feeding log that looks like this. This is to help track feedings for the first week of life. We would encourage you to find an app or a journal and continue to keep a log of feedings and wet and messy diapers for the next few weeks. This helps all healthcare providers know how your infant is progressing. Colostrum to milk. The infant's first food is colostrum. This is a thick yellow substance that is in small amounts. This is perfect for your infant and the amount of nutritional needs. Your milk will take 3 to 7 days to come in. Your breast will feel full and heavy. Your infant will make more swallowing sounds when at the breast. If you have any concerns about milk supply after leaving the hospital, seek lactation help. There are multiple options for you in this area. Feeding cues. There are 3 stages of feeding cues that you will learn quickly. Here's a quick review of them. Early cues. They are just starting to wake. They are looking around, smacking their lips, and starting to stretch. This would be a great time to bring the infant to breast. They are calm and eager to learn. Mild cues, they are stretching more when their hand goes to their mouth and they are rooting and giving off feeding signs. They will have a lot more body movement. Late cues, the infant will start crying, seeming agitated and flailing their limbs. At this time, offer breast or feedings. If the infant is in late cues, there is a possibility that the infant will not settle to feed. Try using calming techniques, cuddling, skin to skin, rocking, and soothing. When the infant is calm, offer the breast at this time. Feeding time is cuddle time. This is a time that all should be enjoying their time together. If it is a stressful time for you and your infant, please seek help from a lactation specialist. We have a list for you to take home. Breastfeeding positions and comfort. Hopefully you have been shown 1 to 2 different positions for breastfeeding during your stay here at the hospital. When you're home, find a comfortable chair and space to set up for breastfeeding. Make sure that you have your water and snacks close by. Relax. Enjoy your time with your infant at the breast. The first few times you feed at home will feel different than when you were at the hospital. The positions will feel a little different. Please make sure that you are supporting your infant and that you have plenty of pillows. There should not be pain at the nipple or at the breast. There will be a strong pull at the nipple and some sensation at the breast as your milk is letting down for feeding. Breastfeeding is a learning time for both you and your baby. Engorgement and mastitis. Engorgement is a phase when milk is coming in and the breast will feel full, heavy, possibly warm to the touch. The breast can feel tender and lumpy to the touch. Be sure to wear appropriately fitting breastfeeding bras. Please do not wear sports bras at this time. Last, use light reverse massage in a sweeping or circular motion. Please offer the breast to the infant after the breast massage to help relieve the pressure. Follow the feeding with the use of ice. Engorgement can last 3 to 5 days. Mastitis. This is a small breast infection that can be treated with most antibiotics in most cases. If mom is running a fever over 100.4 or higher with breast tenderness that is consistent with no relief from feedings or from ice, please contact your healthcare provider so you can receive help. When returning to work and school, your main goal is to protect your milk supply. Having a breast pump to help remove milk at times when you are not able to bring your infant to breast is most helpful. Most insurances will help pay for a breast pump. Please check with your nurse or lactation consultant to see if you qualify for a breast pump. When pumping, you should pump close to the same number of times your infant will feed. You will need to pump for 15 minutes on a minimum. Breast milk storage. CDC recommends fresh pumped milk is good for 4 hours on the countertop, then up to 4 days in the refrigerator. Pumped and frozen milk needs to be used within 6 months. Up to 12 months is acceptable. Please know that no matter how long you choose to breastfeed for, there are many benefits for both you and your baby. The CDC and FDA do recommend for your infant to be on breast milk for up to 2 years, whether you choose to breastfeed or pump and bottle feed, or a combination of both. Breastfeeding is a personal choice for you and your little one. Thank you for letting Madison Memorial Hospital help you on your journey with breastfeeding. I would like to take a brief moment to talk about formula feeding. You might choose to formula feed or need to supplement with some formula for a short period of time. We are here to support you and your infant. I would like to review feeding positions for your infant. Holding upright or holding onto the side. Offering the bottle with pace bottle feeding. Pace bottle feeding helps the infant take the feedings at a slower pace and helps them learn to control the flow. Please reach out to your nurse or lactation specialist if you would like to have the techniques shown to you. When bottle feeding, never prop a bottle and make sure to feed your baby with pace bottle feeding method or with their head up with at least a 45-degree angle. After bottle feeding, most infants will need help with burping. You may place your baby in your lap in this degree or your shoulder or sit them upright. Whichever is most comfortable for you and your baby, gently pat or rub the infant's back until infant burps. Some babies require more frequent burping than others and may need burping in the middle of feedings. Other babies can be very difficult to burp and may benefit from sitting in a swing for 20 to 30 minutes or holding or walking around the room with the baby after each feeding to help get the air bubbles up. Formula prep and storage. Formula comes in many different forms: ready to feed, concentrate, and powder form. Please be sure to read the formula prep information on the label for proper prepping needs. On the formula labels, there will also be storage needs. Please follow these guidelines. Formula is sensitive on how it is handled and stored. Pacifiers. This is a personal parenting choice. If you choose to offer your infant a pacifier, please offer after feedings. Thank you for letting Madison Memorial Hospital help you with your little one. Congratulations.
When you're ready to go home, we will have you bring up your car seat, and we will have you put your baby in the car seat. But before we put the baby in, if you loosen the straps, it's easier to get it around the baby's arms. There's a button here. You just press on that, pull on the straps, and that'll loosen it for you. Once you have your baby, you set the baby in the car seat. Put the straps around each arm. Okay, take the bottom buckle and just snap it into the bottom. Do it with both sides. And I can tell I need to loosen this a little bit more, so you can do that as you go if you need to. Snap that in. Once you got those secured, snap your chest buckle. You'll want it up against the breastbone. To make it tight enough to check it, we'll do a pinch test. If you can pinch the straps, then that is too loose. Pull on the strap down here to tighten it. Try the pinch test again. I still can pinch it a little bit. You can also try a 2-finger if you want it snug on the fingers but not too tight. We still need to tighten it a little bit. So pull that a little bit more. Kind of adjust the chest belt. Okay, so I'm not able to pinch any longer. We want to make sure that this is right over the breastplate. The strongest parts of the baby are on the collarbone to the armpit, and then also their hip bones. So we want to make sure that it's tight in both places there. We don't want the buckle where it's on the belly, because that's soft tissue and that will injure your child if you were to get in an accident. So make sure it's up here on the hardest part of their body. And then once we check that and we're good to go, then you guys have a great day and enjoy your baby.